Welcome to the Radically Genuine podcast. I am Dr. Roger McFillin. Today, we're addressing a critical issue in women's health that affects millions worldwide. For decades, the medical establishment has overlooked one of the most important vital signs in a woman's body, her menstrual cycle. A woman's period is not just about fertility. It's a crucial monthly report card on her overall health. Regular pain-free periods are indicators of hormonal balance, proper nutrition, and good general health. Conversely, irregular cycles, heavy bleeding, or severe PMS can be early warning signs of underlying health issues. Yet, for too long, we've treated the menstrual cycle as an inconvenience to be suppressed or regulated with synthetic hormones. This approach merely masks symptoms without addressing underlying causes. Even more troublingly, hormonal birth control itself can cause the very symptoms it's often prescribed to treat: mood swings, anxiety, depression. This leads to a dangerous cycle. Women are prescribed hormonal birth control, which can trigger or exacerbate mood disorders. These mood symptoms are then misdiagnosed as psychiatric illness, leading to prescriptions for more powerful psychotropic drugs. All the while, the underlying hormonal imbalance, whether natural or induced by birth control, goes unaddressed. By suppressing natural ovulation and hormone production, we're not just turning off a reproductive function. We're disrupting a complex system that influences everything from bone density, cardiovascular health, to mood regulation and cognitive function. On today's episode, we'll be exploring why the current paradigm in women's health care needs to shift from merely treating symptoms to understanding and supporting the body's natural processes, and how to address root causes rather than simply masking symptoms. To have this conversation today, I want to welcome Lara Briden, who is a Canadian naturopathic doctor and the best-selling author of Period Repair Manual, Hormone Repair Manual, and Metabolism Repair for Women. She's currently has a consulting room in Christchurch, New Zealand, where she treats many women with PCOS, PMS, endometriosis, perimenopause, and many other hormone and period-related health problems. A lot of the listeners to the Radically Genuine podcast who are women certainly reaching out on this topic, as many of us awaken to a lot of the problems within Western allopathic medicine, the masking of symptoms, and the causes a lot of their treatments, or the problems a lot of their treatments cause. So, Laura, I want to just welcome you to the podcast, and first just kind of get a background information here for my audience, just about who you are as a professional. What was the inspiration for the Period Repair Manual and your work in women's hormonal health?
Great, Roger. Thanks so much for having me. I'm really excited to be here. So I I won't go too far back, but I will start with the fact that before I became a naturopathic doctor, I was an evolutionary biologist. I actually published a peer-reviewed paper in sex differences in foraging behavior in animals. So I've, from the very beginning, seen physiology and health through the lens of female biology. And then when I became a naturopathic doctor way back in the mid-90s, I just fortunately, I had the opportunity to be on the ground treating mostly women for a lot of things. You can imagine back in the 90s, there was, conjugated estrogen, high dose kind of hormone therapy. There was, everyone was on the pill. There were hysterectomies. It was kind of the Wild West. It's not that different now in some ways, but it was, women were confronting, facing a lot of challenges. So I had to put what I'd learned in terms of using nutrition and lifestyle changes and herbal medicine into action. And I had to see if I could get some results. And thankfully I did. So then I was just practiced full time for a couple decades, really. Some of that, during that time, I moved to Sydney, Australia, practiced there for quite a long time. And I'm happy to report that women all over the world have the same physiology, the same sorts of problems. That doesn't differ by country. I'm now in New Zealand. But about 10 years ago, I decided to write Period Repair Manual, which was my first book. And that was, I'll be honest, that was for my patients. It was from my patients and for them. It was drawing on all that frontline work I'd had with people. I'm very grateful for all, the stories they shared with me, all the experiences I got to see firsthand. And I wrote the book for my future patients, thinking what I wanted them to do was, read the book before they came for their consultation, because then they would have some level of what we call body literacy, or like some understanding of what we're trying to do here. And that was my main motivation. And then I'm very grateful because the book has become quite popular and reached women and doctors and gynecologists all over the world. And it's been very rewarding. And I do think we are in a paradigm shift around women's health. It's great timing for your podcast. We're a few years into this paradigm shift, but it's a very different landscape than it was even 10 years ago when I started writing the book.
I certainly see the landscape changing. And sometimes I wonder if it's just the social media algorithm that I'm in, because what I see in frontline clinical practice is that most of my patients aren't being provided this information. They're still kind of under the brainwashing that a pill for every ill. So I want to start with some basics here. Can you explain why ovulation is so important to overall health, not just for fertility?
In a nutshell, ovulation, regular monthly ovulation, is how women make hormones. So men make them daily. The way I see it through my lens is, because I'm a biologist, I tend to think, I frame it as female physiology as the standard, normal, default version of human physiology. And then we have the quirky male physiology, which is very quirky in lots of ways across many species. Male humans, make their hormones daily, which is fine, works for you guys. We, during reproductive years, make them on a monthly pattern. And of course, those hormones, the two big ones, ovarian hormones, estradiol, our main estrogen, and progesterone, are beneficial for general health. They're not just for making a baby, even though they've been treated like that for literally decades. The analogy I give is, to treat ovarian hormones as just this optional add-on you might need one day to make a baby would be like saying to men, don't worry, you don't need your testicular function. You don't need your testosterone until you're ready to make a baby. So we're going to shut it all down with this medication, and we're going to replace your testosterone with this other medication that's kind of like testosterone, but really a little bit like estrogen, and not like either of them. And it's going to cause some side effects and change your physiology and change the shape of your brain. But don't worry, because that's what everybody else is doing.
Do you think conventional doctors are kind of informed of this? I hear some of the craziest things, like just what you just said. I've heard doctors kind of minimize the importance of a period at all, and even describing it as an inconvenience.
The old paradigm is that women don't need ovulation. That is 100% the paradigm that has existed. There's many people been pushing back against that. There's a professor who's been very influential for me. She's an endocrinology professor in Canada, Professor Geraldine Pryor. She's a scientist. She has 45 years of scientific papers under her belt. She's just been at this. She's been a champion for women's health. And one of her great quotes that I often put out into the world is, women benefit from 35 to 40 years of regular ovulatory cycling, regular natural menstrual cycles, not just for fertility, but for, prevention of osteoporosis, dementia, heart disease. And she even puts breast cancer in that. And that's because progesterone, through her lens, probably shelters us to some extent from breast cancer. There's some, debate around that, like there is around everything. But I think that's a really important message. And then one of the pushbacks to that, I don't know if this is a question in your mind, but I'll just, put forward one of the questions that's often said at this point, which is that, but our ancestors never used to have as many periods as we do now. So, on the one hand, making this argument that we need these regular cycles to make hormones, to build metabolic reserve, to build long-term health, certainly to build bone density as just the most obvious example. It is true that our ancestors didn't do it the same way. I addressed that a little bit in Period Repair Manual. They, of course, were pregnant or breastfeeding a lot more of the time. We're different from our ancestors in that regard and in many regards. But my answer to that is that's, fine. Like most of us are not going back to that life history. But at the the bottom line is the contraceptive medications do not mimic that state. There's been this narrative that they mimic pregnancy. That is basically incorrect. I mean, they mimic pregnancy only if they sort of, shut down the signaling from the brain to the ovaries, but they do not provide the same hormones that pregnancy does. So during pregnancy, of course, we have a huge amount of estradiol and progesterone, the beneficial hormones that I'm talking about. So we can either make them monthly or we can make them, with several pregnancies. Either way, we're getting a good dose of hormones and the brain is getting a good dose of hormones. And we know from some of the emerging research that, we know hormones change the brain, of course. They change the brain even just throughout a woman's menstrual cycle. It changes shape a little bit. And so logically, women on contraceptive medication their brains are also changed by it. Which is quite concerning. This is like, 2020s, and we're just now figuring this out, which explains a lot.
Yeah, I do want to get into a lot of questions about hormonal birth control and its effects. So you just started there, but I have some questions leading up to it, because you see a lot of women, especially adolescent girls, are placed on hormonal birth control to regulate their period, quote unquote, regulate their period. And that included one of my daughters. So what are some of the common period problems that you see that might indicate underlying health issues? I opened this up by saying, hey, this is a kind of a signal. It's part of a monthly report card on your health.
Yeah, it's called the fifth vital sign or the sixth vital sign, depending on how many vital signs doctors decide there are. This is not a radical fringe view that it's a fifth vital sign. ACOG, or the American College of Obstetricians and Gynecologists, came out with a statement. I quoted it in my book. I think it was like 2016, basically saying the menstrual cycle is a vital sign in that it's an expression of general health. So being able to have approximately monthly, it doesn't have to be a 28-day, approximately monthly ovulation means everything is working well. Like, the woman is fully nourished. She, doesn't have chronic inflammation or, a disease state. She doesn't have insulin resistance, for example. And so, that was when they released that statement, my jaw hit the floor. I was like not expecting that. That was very different from, that was kind of the beginning of a paradigm shift. I think the fact that they would acknowledge that was amazing. They even say in that statement, doctors should be asking girls about their natural menstrual cycles and suggesting they track their natural menstrual cycles. So I do have to respond to this narrative that the pill can regulate the menstrual cycle. That narrative is like, it's an emperor's new clothes situations. It's so incorrect that it's somewhat baffling. It's just not somewhat, it's completely baffling that it's survived this long, that it still sort of holds on. It's the menstrual cycle is structured all around ovulation, which is, the releasing of an egg, but it's also, as I said, is how we make our two main hormones. Because healthy ovulation usually comes on an approximately monthly cycle. That's the reason for a monthly cycle. So to then sort of with oral contraceptives or with the pill, like to shut down ovulation, flatline hormones, and then induce a monthly bleed is completely nonsensical. Like, there's no medical reason to bleed monthly on the pill. It's done to mimic a cycle, but it doesn't mimic it in any hormonal sense of the word. So it's really this kind of false reassurance. I will acknowledge, it's important, there can be a requirement to shed the uterine lining at some interval. And, I think with being on oral contraceptives, like if you don't allow a uterine lining shed at some point, it will just start to, break through bleed. And that's fine, but that doesn't have to be monthly. So then we get these weird, like acrobatic thinking. The idea is you have to have this, you can regulate the cycle, by dosing these drugs monthly. And then about 5 years ago, there was like, oh, well, actually, you don't need a monthly bleed on the pill. So then the segue was like, well, oh, so you don't need a monthly. So women don't need periods. You don't need a monthly cycle. And there's sort of this illogical leap between you don't need a monthly induced bleed to you actually don't need monthly ovulation. And those are two very different things. And I know you did ask about, which I can answer now, what are the possible causes for a girl not having a monthly cycle. Should I answer that part now? Yeah. Multiple. So it's an expression of health. I don't know if your audience will resonate with this. There's any sort of statistic people in the audience. There's something called the endocrinina principle, which is from the first line of the Tolstoy of the novel Anna Karenina, about how, I think you might know it. The quote is, there's only one way to be a happy family, and there's multiple ways to be an unhappy family. So this idea that there's one way to have a menstrual cycle, and then there's literally dozens or hundreds of ways for that not to happen. Basically any requirement that's not in place is going to result in an irregular cycle. So that's how it's an expression of health. So in girls, a really super common one, and I can't speak specifically what was happening with your daughter. There's lots of reasons actually, but a common one with young girls is under eating. Just simple fact of not nourishing enough is one. There can be other sort of medical, conditions going on can influence it. There is also, unfortunately, kind of sort of a growing trend to kind of higher than normal androgens in girls. That's kind of an early PCOS or an early polycystic ovary state that can produce irregular cycles. There's also the fact that, just as a baseline, it takes girls, when they first get their period, they're not expected to be regular. I mean, they are a normal cycle in the early couple of years would be, even if it's coming every 45 or 50 days, that's pretty good. Those early cycles, a lot of them won't have actually ovulation as part of them, which is why they can be quite heavy in the beginning. So that's all part of the maturation of the menstrual cycle. So on the one hand, there's this expectation, to let the girl sort of develop her menstrual cycle, hopefully with relatively few symptoms. And then if it's really not coming, starting to, build into a monthly cycle, then start to do some troubleshooting and investigate. Is there other examples might be gluten sensitivity, zinc deficiency. These are all various troubleshooting topics that I explore in my book. And my experience is a lot of the time, especially with teenagers, their body's pretty dynamic and responsive. So that's one of the things I've been able to learn on the ground, is treating teenagers and just helping their bodies to do their thing and get mature into a regular menstrual cycle.